Gubernaculum is the one which will be giving rise to the round ligament of the uterus, and the ligament of the ovary is what I want to reinforce to you. Once more, I want to do ragging today on interleukins to you, so that entrance exam may interleukins you are not going to forget, doctor. Now, which interleukin supports the growth and differentiation of the bone marrow stem cells and functions like a granulocyte macrophage colony stimulating factor? Who will give me correct answer? Dr. Siri says IL-2, Sumati says IL-3. What is your proposal, doctor, from Nampally? What is your lucky number? 1, 2, 4, 5. Dr. Anuja from Pune says IL-3. Anantapur also says IL-3. IL-3 in fact is the one which you are going to remember, which works like a GM-CSF is what you need to remember. So 5 interleukins which you are not going to forget to survive the tomorrow's NEETPG exam. IL-1 responsible for fever. IL-2 stimulates the T cells. IL-3 stimulates the bone marrow. 4 stimulates the IgE production. 5 stimulates the IgA production is what I want to ultimately ensure you. Now, a 23-year-old unable to extend the fingers. Extension is mainly because of radial nerve, as all of you know very well. Median supplies prunitus and the flexors of the fingers, thumb and wrist. Ulnar supplies flexor carpi ulnaris and portion of flexor digitorum profundus, medial portion. Axillary supplies deltoid and teres minor and involved in the abduction. Musculocutaneous innervates the flexors of the elbow joint, especially biceps brachii, is what you are going to ultimately remember. It is the meralgia peristhetica, which is due to the lateral femoral cutaneous nerve, is what need to be remembered. It is the inferior orbital fissure through which the infratemporal fossa will be communicating directly with the orbit, is what I want to underscore to all of you. The medial portion of the lower lip typically will be metastasizing to the submeatal group of the lymph nodes, is what need to be basically remembered. What happens in multiple sclerosis? There are autoantibodies against the oligodendrocytes, and the myelin formation is what you are going to ultimately remember. What is that CD marker? One more point for ragging in the entrance exam. Which CD marker for which cell? That list, no? Now it is the time before the aeroplane takes off on the NEET ride. You must be ready with small lists which are the must and should kind of topics for the entrance exam. Which is unique marker for NK? Very good. Shankar says 99, Sumati says 56, so also Anjum, and Madhavi says 56, and Shankar recorrects himself as 56. CD 16 is the one which binds FC of IgG. CD 56 is unique marker for the NK cells, is what need to be remembered. So doctor, CD markers, how to survive NEET MD entrance. CD4 helper, CD8 cytotoxic. Right from our LKG we are studying that, no big deal, everybody remembers. CD3, 28 important for T cells, because CD28 binds B7 on the antigen presenting cell. For the B cells, CD21 is the receptor for Epstein-Barr virus. So 19, 20, 21, 40 important for B cells. For macrophages, we need to remember CD14, 40 and C3b. Any kutti book for MD entrance preparation will give this list. But my job as a teacher is to remind you, don't ignore this list, because it is a dirty list among the single liners which can be bottleneck in deciding the fate in the entrance exam is what need to be remembered. Okay, doc. This is a good logically oriented question. pH is 7.32 means acidosis. When acidosis is there, it can be respiratory or it can be metabolic. First look at the bicarb. If the bicarb is low and acidosis is there, then it is primarily metabolic acidosis. When metabolic acidosis is there, who offers compensation, doctor? The respiratory compensation will be there. What kind of compensation will be there? Whenever metabolic acidosis is there, we try to overventilate, get rid of the CO2 from the body, and that lead to low CO2 levels. So a low PaCO2 with low bicarb means primarily it is a metabolic acidosis is what you will be able to conclude. Now coming to the arachnoid villi, it is a subarachnoid space superior sagittal sinus into which the arachnoid villi will allow the CSF to pass is what need to be remembered. Now doctor, this question requires a little modification. Second mistake in our question paper which you need to, in short time we are conducting 2 papers every week. 4 to 5 errors will be there, which is not a sign, it should be. And then D becomes answer. We get tachycardia, not bradycardia in the case of the hemorrhagic shock. Now, how do you want to increase the stroke volume if there is a cardiogenic shock is an important issue. You know very well stroke volume depends upon the amount of cardiac output and ventricular contractility, inotropic state of the heart. By giving dobutamine, we try to increase the inotropic contractility of the heart in the cardiogenic shock. Do you want to give dobutamine in hypovolemic shock? Never. First priority in hypovolemic shock is to give fluids. Only when you replenish the fluids adequately, then only you need to think about giving the inotropic agents is what you have to basically remember. If you give inotropes without giving fluids or before giving fluids in a patient of hypovolemic shock, you are killing the patient and trying to tire down a horse which is already tired. That's what is the important aphorism. Where is perilymph located? Typically it is the scala tympani which contains the perilymph. And if you look at endolymph, endolymph is similar to ECF in its composition. And endolymph is mainly produced by the highly vascular structures which are located along the lateral wall of the scala media. You have the endolymph which is very similar to ECF is what you are going to ultimately remember. Now give me one confident answer, doctor. All cells except which cell doesn't contain, all cells contain MHC1 except which cell? Who will give me the correct answer? One confident answer. We have Dr. Sunayan, who is one of the very energetic students, regularly giving answers and correcting us. Our key is online today. Yes, you need to participate and get ready, fully charged at the end of 3 hours of discussion to arise, awake and stop not until you win the NEETPG. That should be the goal. Okay, give me one confident answer, doctor. Dr. Shweta and Shankar and Anantapur rightly say RBCs which are not nucleated. All nucleated cells contain MHC1. Now, it is the occipital and straight sinus are the pair of venous structures which contribute to the confluence of the dural sinuses at the inferior surface of the occipital bone. Now doctor, when there is an isotonic exercise, what is most important? It is the stroke volume which will increase, because isotonic exercise will cause sympathetic stimulation which will increase the stroke volume. If there is a raised ICT, Cushing's response, what is that? There will be reflex bradycardia. There is a raised BP and a reflex bradycardia in the people who have a raised ICT. To improve the cerebral perfusion is what need to be remembered. Cholinergic stimulation lead to meiosis, sympathetic stimulation lead to mydriasis. I think most easy question in the entire paper. Left ventricular wall stress. What are the factors on which it is dependent on? Whenever the thickness of the wall increases, the wall stress is reduced. Any increase in the systolic BP or increasing end-diastolic volume will increase the wall stress. That's what we need to understand. Now tell me, doctor, in bullous pemphigoid, pemphigus vulgaris, which type of hypersensitivity is involved? Is it type 1, 2, 3 or 4? Bullous pemphigoid, pemphigus vulgaris, these are all the disorders because of an antibody produced against the fixed antigen or a floating antigen. Fixed antigen which is located in the basement membrane of the tissue. Type 2 hypersensitivity means free antibody against a fixed antigen. Type 3 means free antibody against free antigen together forming an immune complex and going and depositing in the tissues is called type 3. That's good. Everybody answered it as type 2 except Shankar and Shravya, and Anantapur wrongly answered it as type 3. No, it is not type 3, it is type 2. Hemolytic anemia. What is hemolytic anemia? Antibodies against a fixed antigen on the RBC membrane. Pernicious anemia. Antibody against a fixed antigen on the parietal cell. And ITP. Antibody against a fixed antigen on the platelet. And bullous pemphigoid, pemphigus vulgaris. Antibody against a fixed antigen on the basement membrane. Makes it type 2 is what need to be remembered. Now, a patient is intubated and placed on a mechanical ventilator onto his left side. What is the situation in dependent lung? Always, doctor, perfusion will be more in the dependent part. Ventilation will also be more in the dependent part. But ventilation by perfusion will be less in the dependent part than the independent part. Non-dependent part is what you have to remember. Now coming to a preterm infant. In preterm infant, the pulmonary vascular resistance is very high, and that is the reason the pulmonary blood flow will be typically lesser in case of a preterm infant is what I want to underscore.